Both robotic surgery and laparoscopic surgery fall under the umbrella of minimally invasive surgery. The difference between laparoscopic surgery and robotic surgery, put simply, is the robotic system. So with laparoscopic surgery, the surgeon is standing at the patient's bedside, performing the surgery using very long instruments through small incisions. Whereas with robotic surgery, the robotic arms are connected to those long instruments, and then the surgeon controls those arms from a console that is separate and away from the surgical space.
Almost any child may be a candidate for robotic surgery. Here at Boston Children's, we have treated patients as young as 3 to 4 months old. I personally find robotic surgery very helpful for patients with complex conditions or challenging anatomy. For example, robotic surgery can be used to relieve the obstruction to a kidney. Robotic surgery can also be used to remove portions of the kidney, either for benign conditions or for cancer, and reconstruct the kidney thereafter. More importantly, we are now able to offer multidisciplinary care, so patients who have conditions in urology, gynecology, oncology, and colorectal issues can benefit from this technology too.
In cancer care, we often use many different therapies to treat the child, and one of those therapies is often surgery. And in order to improve surgery and to improve the outcomes of the children that we are treating, we often use robotic-assisted laparoscopic surgery. The advantage of robotic surgery is really the increased ability for the child to recover much quicker and to move on to their next phases of care.
General anesthesia times tend to be shorter with a skilled surgeon driving the robotic system. But there's also the cosmetic advantage of smaller incisions that are very difficult to see after things are fully healed.
We are able to perform more precise surgery, and when we can handle tissues more delicately, they heal better. As a result, quality improves, safety improves, our patients do better with higher success rates, and our complication rates decrease.
We have the actual expertise to do all the surgery here, which is very different than many other institutions. We have learned from our adult colleagues, and we continue to adapt from them to get all of the advances that they're doing, but convert those into what we can do for children. Kids just aren't little adults. And so thinking about the care that they need, thinking about how this affects their physiology and their long-term quality of care, quality of life, is super important.
Your movements, the way you use the instruments, it's very natural. It's pretty much like open surgery in terms of the movements. So you can be very precise. At the end of the day, it comes down to the surgeon that's behind those instruments. Technology is great, but of course, what's most important is the patient.